Hello, my name is Chris Heckert, and I'm Senior Director of Labeling Solutions at Network Partners. Our labeling team works with medical device manufacturers to help them achieve their labeling goals, from meeting EU MDR requirements to conducting gap analysis and process assessments, to deploying new labeling systems. Our team of SMEs, application engineers, project managers, graphic artists, and label technicians have seen the spectrum of labeling processes and systems. We feel this perspective gives us an insight into med device labeling that's unique in the industry. Seeing how company after company treats their labeling as a necessary but unimportant requirement, it's seen as an administrative task. Labeling seldom has a voice past the manager level, and when labeling issues are addressed, it's with temps or contract employees to get a bolus of paperwork done. My personal belief is that medical device labeling is one of the most underappreciated aspects in the healthcare industry. Labeling is like gravity, invisible, but influencing the movement of every medical device in the supply chain. So a corollary to the lack of appreciation for labeling is the lack of appreciation for med device labeling systems. We see companies, smart companies, successful companies, delivering world-class medical devices to the healthcare providers using labeling processes that exist solely due to the heroes in their labeling departments. These label technicians are typically managing several systems due to mergers and acquisitions. They know how to manually update each system to make sure that shared data is available. They know how to fool the systems to quickly switch country of origin on a part sourced from multiple countries. To shave a month off the development time, they typically supply the missing content to the label requests. They guard, with their lives, the last two remaining Windows 98 desktops, which they've isolated from the network in order to be able to label that suture product line their company acquired back in 2002. Multi-billion-dollar companies running labeling systems that won't stand up to a stiff breeze. Several years ago, I won the prize of putting in a global labeling system. And I'm sure it was because I was the loudest critic of how much time labeling took from our packaging development department. All of our sites shared that frustration. So when we made a concerted effort to wring the most efficiency we could out of our new system, when the dust settled, we had a labeling system and a labeling process that took care of 37,000 SKUs and was run by 3 people. In the following 5 years, we had 1 field action from a mislabel. And that was a product that had been labeled at risk and wasn't reworked before it shipped. We could get a label request and have a new or revised label out for approval the same day. 1 week, we revised 10,000 labels. Our contract manufacturers logged into our system and printed labels that we created and approved. Our labeling data was the best master data in the corporation and was always accepted as the source data. We pushed our labeling system into our European distribution center, printed and applied country-specific labels to existing inventory, and saved $6 million a year. We also took 175 tons of paper out of the waste stream by getting rid of pre-printed IFUs. It let us get into emerging markets as quickly as we could get product descriptions translated. Our labeling department and our labeling system was an absolute joy to work with. Let's look at some of the major improvements that GLS provided. 7 reasons. Right out of the box, we got 3 improvements that justified the GLS. We got a validated system, including Part 11 compliance. We got the ability to let our contract manufacturers use our GLS to print labels at their facilities, and we gained the ability to run where used reports on all the products. Because the system was designed for med device, we leveraged the system to make significant process improvements. It made mass changes a snap. We redefined our labeling specification to be the latest approved version in the validated labeling system. This meant that we didn't have to issue item numbers for label specs, which meant we couldn't reference it on a BOM, which meant no more BOM updates for the label content. And after we got our manufacturing sites up and running on the new system, we moved the system into our European DC for delayed labeling and country-specific labeling. Oh, and our packaging engineers went from putting out the daily labeling fires to working on their packaging issues. One very important piece that I need to tell you is that this GLS can only support these improvements if it manages the label content. A data aggregation system, a system that pulls static label content out of your ERP and PLM systems, is limited to what it can support with regards to process improvements. This concept is so important that we made an explainer video about this distinction. After trying to communicate this with PowerPoints and hand waving, this video made showing the advantages of this type of system clearer. I'm going to take a couple of minutes to show it to you now.
Single source of truth. Best practice. Single source of truth. Why would you store the same master data in two different places? Single source of truth is a great way to manage your master data, and it's a sound strategy. Aggregate data from your enterprise systems to make sure you're using the best data without having to manage duplicate databases. But when it comes to medical device labeling, your ERP, PLM, and MES systems typically don't store label elements, or at least the data elements as you want them on your product labels. If you're using a data aggregation system to label your med devices, you have to put processes into place to make sure this not private data is under very tight control. Without a stoplight, changing data in an enterprise system immediately changes the label. These controls require creating or revising engineering drawings, bills of material, and managing the sequence of events to get everything on the correct effectivity date. Need to add another site? New processes must be put into place to map the aggregation to completely different systems, with different data governance. It's difficult to set up and maintain. Additionally, as errors occur or other non-label related changes happen, the manual processes that protect the data will have to change. These systems become bloated, with many approval steps between change notice and final approval. And these slow, clunky, resource-intensive processes are also very prone to human error. Your label data is a part of your product, and your label data is under constant refinement due to ever-changing regulations by ever-active regulatory bodies. There's a better way to control med device labels while still using a single source of truth, albeit not in your typical enterprise systems. It's using a system that's sophisticated in managing labeling data when the data is controlled solely within the labeling system itself. Your labeling system should be designed to handle changes. Keeping the label data in a system that's accessible to just a few people allows the system to manage the data in what would otherwise be handled by manual processes. The label specification is the latest approved version in the labeling system. No engineering drawings, no bills of material, no extraordinary coordination with the rest of the company to keep everything in sync. Now it only requires a couple of super users to quickly create new labels, make mass changes, manage country-specific labeling, scope projects, and create quality reports. And if there's an additional site or acquisition, the processes stay the same, and the data management system simply scales the internal database to accommodate the additional labels. This system, with its own single source of truth, teamed with a streamlined development process that delivers a complete label request from the right people to the labeling super user, produces labels quickly and efficiently. Check out what a commercial off-the-shelf data management type labeling system can do for your labeling. Address your labeling situation before the next major regulation change. Contact network partners today.
Your labeling system has to manage the label content. If it doesn't, you'll be limited in the process improvements you'll be able to make. Now that we understand what the basic system looks like, let's look at the benefits you realize right out of the box. Oh, and by the way, you want a commercial off-the-shelf labeling system. These guys have developed solutions for med device labeling. If you need your labeling system to do something other than what these systems do, out of the box, you're likely doing something wrong. First off, you're getting a validated system. Per 21 CFR 820, automated processes. When computers or automated data processing systems are used as part of the production or the quality system, the manufacturer shall validate computer software for its intended use according to established protocol. All software changes shall be validated before approval and issuance. Along with compliance to this requirement, you also get Part 11 compliance. Part 11 compliance includes the requirement of an audit log. So now you have a record of every label printed, how many labels were printed, who printed them, and when they were printed. This supports some of the features in the process improvement parts of this presentation. This is a real important feature. And lastly, you have documented reliability. You can count on your labeling system to perform as expected. This reliability also provides for another significant process improvement that we'll discuss in a few minutes. When I first got started in labeling, we would fax a picture of the label we wanted our contract manufacturer to provide, and they would fax back their attempt at making our label. We would mark it up and fax it back, and so on, until we agreed to the sample. Then they would print a couple of labels and stick them on a piece of paper, add an approval signature, and mail them to us, where we would sign both, mail one back to them, and put the other in a folder called Approved Labels for Contract Manufacturer Number 1. We would then hope that that was the label they would put on our product until we had to change the label, where we would start the faxing process all over again. Today, that sounds ridiculous. But if you replace fax with scan and email, and that describes your current method of controlling your labels at your contract manufacturer, you can't laugh at how we did it 27 years ago. Your GLS allows for your contract manufacturers to log into your system with rights to only print the labels for the products that they package. The labels are designed by you, approved by you, and are managed the same way all of your labels are managed. Labels that you create or revise this morning are printing at your contract manufacturer this afternoon. And this feature is enhanced by another process improvement we'll discuss in the second part of this presentation. For those of you who have the ability to run where used reports, you know that scoping any labeling project is a snap. Need to add the MD symbol to all labels going to the EU? Search the labeling database for every SKU that has an CE mark. That's your scope. For people that have this ability, being able to run a where used report is an often overlooked feature. This is not the case if you can't run a where used report. You might need an army to establish the scope of the same situation. Or in the words of a labeling manager I spoke with a week ago, Singapore needs to know which of our products contain phthalates. I have to look at 10,000 labels and look for the phthalate symbol. In this case, you could answer this question reliably within a couple of minutes with a where used report. Or if you don't have a where used report, you can look at every label specification, if you know where all those label specifications are, and have some label technician go through every specification and look for the phthalate symbol, and hope you did indeed look at every label. Labels stored as images are of no value when scoping any type of project. And what we see is that most MDMs have multiple labeling systems, and that some of those labeling systems are indeed storing their labels as images. Being able to scope any project, not just labeling projects, affects the entire company. Being able to identify products based on the labeling element is difficult to quantify, but if your company has a history of not being able to scope projects effectively, this is a real significant tool. Furthermore, in my experience, label elements are a great differentiator when scoping projects, as they're linked to materials, distribution, specific markets, brands, sterility, country of origin, and so many areas that your company may need to sort. Whenever we had to schedule an HHE, a health hazard evaluation meeting, the first order of business was to send a quality engineer down to labeling to understand the scope of the problem with our where used reports and our labeling audit log. It was a beautiful thing. So the out-of-the-box features, validated, existence of a supplier portal, and the ability to run where used reports are kind of big, broad features. These features benefit departments across the organization. Now let's talk about the features that really help the labeling group help the company. First off, let's look at mass changes. The primary feature of a GLS is the ability to easily adapt to changing requirements, or simply the ability to change a lot of labels securely and quickly. Change the notified body number on all Class II parts with a CE mark. Change the authorized European representative address for all products with a CE mark. Add the MD symbol to all products with a CE mark. Add the United Kingdom conformity assessment symbol to all products with a CE mark. Add the authorized Swiss representative address for all products distributed in Switzerland. We could go on and on. If you're storing your labels as images, open each file, make the change, version the label up, and send everything out on the change notice with the from and to labels attached. No, wait, for those of you who redline, and that is what most companies do, find the specification, create a redline, send that out in a change order, and then open each file, make the change, and so on. Real situation. Big company, lots of labeling resources, mass change needed. In a war room environment, daily support put on hold, this company was able to change just over 100 labels a week. In the beginning of this presentation, I told you that we revised 10,000 labels in a week with a fraction of the people. That's the power of a content management global labeling system. If you're disciplined in maintaining a small number of formats or templates, you can literally change every label you have in a day. Now, if I could see you, I'd see some of you shaking your heads right now. You're thinking, I can change all my labels in a day as well. The day after I get 10,000 red lines created and approved. Changing labels can be fast, but the process of planning that change and approving that change, that's what takes all the time. Don't check out of the presentation just yet. What if I told you that your global labeling system has a feature that allows you to dump your current specification and by association your need to redline those specifications? What if you change the definition of your label specification from that engineering drawing with a discrete number to the latest approved version of that label in your validated global labeling system? Hey, where's the label specification for part 1, 2, 3, 4? It's right here. Do you want me to print a PDF? Well, how do you know that's the right version? It's the latest and only approved version in our validated labeling system. Sure, print me off a PDF. Use your labeling system as your document repository for approved labels. Your label specification is the latest approved version in your validated labeling system. Eliminate the redundant engineering drawings. Eliminate redlining these drawings as part of change control. Simply describe the change in your change control, make the change in your labeling system, add the current and revised label PDFs to the change order, approve it in change control system, and enable it in the GLS. And before you say, but the approval process still takes a lot of time, I'll say to make the label revisions that are mass changes approved by a shortened approval list and more streamlined process. If the only change is the MD symbol or a new address for the European authorized rep, do you really need 10 departments to approve that? Knock that mass change down to QA and RA, or RA and labeling. Save everybody's sanity. Now, this next feature goes hand in hand with defining your label specification as the latest approved version of the label in your global labeling system. You may have processed that my make-believe conversation from a moment ago asked for the label for part 1, 2, 3, 4, and you may have thought that you have 2 labels for part 1, 2, 3, 4, a pouch label and a shelf box label. So how do you square this? Your GLS has the capacity to have multiple labels for an SKU. These labels will be discrete by tying them to a label type. Shelf box label, pouch label, country-specific label. One way to control which label prints is by locking a type or types to a specific printer. For example, shelf box label only prints at the boxing station. Country-specific label only prints in the distribution center. This way you can leave the particular label stock on each printer. You keep the label stock number on the packaging material BOM, but you get to eliminate the printed label part number from that same BOM. That's a big deal. This now brings your BOM into alignment by only having inventoried parts on the BOM. Since your validated label system knows which label to print when prompted, you don't need to manually manage the bill of material. It may take you a moment to wrap your head around this concept if you've never seen it before, but it might be the most positively impactful thing you can do for your labeling process. Here's the impact of applying these 2 last process improvements. You need to change the notified body number on all your labels going to the EU. You gather all the impacted label specifications. You create a change order to change the notified body number. You send these change orders out for approval. You redline each and every one of these label specs. Upon approval, you close out this change order and open others to revise the specifications. You send these change orders out for approval. You get new item numbers for each of the labels. You create new specifications. Upon approval, you close out these change orders and open others to revise the bill of material and manage the effectivity dates of the change. You carefully make sure that as you change the bill of materials, you simultaneously approve the new version of the label and make the old version inactive. Then you find out that you need to add the UK conformity assessment mark to every label that's being distributed in the UK. In the new process, you need to change the notified body number on all your labels going to the EU. You run a where used report to find all the CE marked labels that have the offending notified body number. You create a change order to change the notified body number. You get this approved. In 15 minutes, you make the change, and the system automatically versions up the label. Immediately after this change, the revised labels are printing in production. If anyone ever needs to see which version of the label printed on which lot of product, you consult the audit log. I see a hand up in the back. How does the operator verify that the label prints in production is correct? That's a great question. It's really important. Hopefully, they verify the label the same way they verify the label today. They compare the printed label to the label specification. It's easy because the label system brings the label specification, which is the latest approved version of the label in the label system, up on the screen at the labeling workstation. If you don't have an EDHR, you can do a print screen and add this specification, which you're using as a label verification sheet, to your DHR. This is exactly what we did. We actually applied our confirmation labels to that sheet and put that sheet into the DHR. If you're using engineering drawings and controlling label content with bills of material, this is a game changer for both efficiency and quality because you're eliminating that dual database. Now we've covered 6 really impactful aspects that easily justify getting a global labeling system. And yet there's one more feature that your supply chain people are going to love. Country-specific labeling, print on demand, delayed printing, whatever your company calls it, without a global label system is really hard. Some companies try to put all their country-specific labeling on the label they apply in production, but that comes with a host of complications, including having to get the approval from one country to change another country's labeling requirement. It's also likely that you can't fit all that label content on your current label. What you can do is create a production label that covers most of your markets, and then print country-specific labels for your minor markets at your distribution centers. These labels get added to inventory product when you're picking orders for Argentina, Turkey, or Lithuania. It isn't necessarily easy, but it's not as hard as you might think. You've got to make an organizational decision to add labeling to your distribution center. This is going to cost a couple of bucks, and your warehouse management has to agree to take on a labeling process. Since labeling is considered a manufacturing process, you have to extend your quality system into your distribution center. Sounds scary, but it's not that difficult. Use the same labeling procedure you use in production to label in your warehouse. Perform a line clearance, request a label from the system, confirm legibility, verify that the label is correct, affix the label, repeat. We streamline this process by using barcode scanning to move through these steps. You need training and process monitoring, but again, it's not that hard. And lastly, if your country-specific labeling does not include products being distributed in the U.S., you don't have to meet 21 CFR 820 requirements of including evidence of your labeling in the DHR. You are being held accountable to labeling recording requirements of ISO 13485, and your audit log serves as your file for recording these labeling activities. Tacking this feature onto all the other process improvements enabled by your labeling system means that you can create or revise country-specific labeling quickly, use a shortened approval process, and be printing that label the same day. Validation, supplier portal, and the ability to run where used reports on label content are your out-of-the-box features, but properly set up, your GLS offers so many more opportunities. Change 1,000 labels in a day. Eliminate redundant specifications. Drop the bills of material maintenance. Add a country-specific label on existing inventory and ship to emerging markets tomorrow. Each one of these on their own could justify a new global labeling system. The scalability of these systems for mergers and acquisitions, the increased reliability of a system that produces part of the medical device, the increased speed of repetitive tasks, the elimination of redundant effort, the simplifying of a complex process that touches every product, and the speed to emerging markets practically demands the move to a global labeling system. If your competitor has this functionality and you don't, they will beat you to the compliance every day and not have to commit money or resources to the task. They'll also own those emerging markets. And we haven't even mentioned how your GLS will allow rework in place in May of 2025 when any product that isn't labeled to the EU MDR requirements can no longer be shipped in the EU. But that's another presentation. Thank you for your time today.